Hello, it's Dr. Rhonda Johnson. Today's Thursday, September 8th, 2022, and it's September, and it's time to think about flu shots. Well, virologists, infectious disease experts, scientists, they try to predict how the flu season will be from year to year, and that's not always easy to do. But for the past couple of years, the flu seasons have been relatively mild across the world, and that's been to COVID and people taking extra precautions such as wearing a face mask and washing their hands. But with most COVID precautions falling by the wayside, experts are warning about a bad flu season. Now, they're not just trying to scare people, folks. They looked at what has happened in countries like Australia and New Zealand. They're in the southern hemisphere, and they just had their winter months. Now, apparently, Australia had its worst flu season in 5 years. Rates of flu cases were 3 times higher than normal. And in New Zealand, rates of flu cases have been higher than they've been in the past 2 years. And in both Australia and New Zealand, the flu season started earlier. Now, it's almost impossible to predict what's going to happen in the United States this flu season, and I'm certainly not trying to predict, and I'm not trying to worry anyone, but besides covering your cough or sneeze, you may want to consider getting your flu shot, especially if you have pre-existing medical conditions or you're in a high-risk group such as pregnant people who have respiratory conditions such as asthma or chronic lung disease, diabetes, obesity, heart disease, kidney disease, cancer, immunosuppression. I certainly can't list all of the conditions that put you at increased risk for flu severity, and certainly being 65 and older. Also, parents, babies who are 6 months older, and children should get a flu shot. Now, if there's the first time getting a flu shot, they divide the dose. In children up to 9 years, they get half the dose, and then they get the other half 4 weeks later. But the bottom line, my message today is it's early. Yes, it's early. It's just early September, but it's not too early to be thinking about the flu shot, and it's not too early to be talking to your doctor about what flu shot is best for you, because there are several options, and when you should receive it. Now, I'll be talking more about flu shots in the weeks ahead, but I wanted to plant this seed today. All right, that's my message today. I hope it's helpful. As always, please be safe, take care, and be well.